are you?
I'm good. How are you?
I'm doing well, thank you. My name's Megan. I'm your nurse. I'm going to be doing your assessment today. First, can you just tell me your name?
I'm Allie Carlucci.
Okay. And where you are right now?
I'm at the clinic.
Okay. What date it is?
Today is April 21st, 2017.
Okay, perfect. And can you just tell me a little bit about why you're here?
Yeah, I'm just here for a checkup, just my annual physical.
Okay, awesome. Can you tell me a little bit about how you're feeling today?
I feel good.
Okay. You're not feeling any excess fatigue, any pain anywhere?
No pain. I haven't been tired.
Okay, awesome. So you're just coming in for just a regular checkup. Wonderful. Well, first, to get us started, I'm going to grab some vitals from you. I'm just going to check your blood pressure. Okay. Here. Doesn't feel too tight, does it? Nope. I got 116/72, which is very good. Alrighty. Okay, I'm going to check your temperature. I'm simulating getting the temperature. All right, you're at 98.6, which is normal, no fevers. Okay, so your level of consciousness seems appropriate. Just inspecting you, it seems like you were well groomed. Your affect is appropriate for the situation. You don't appear in any sort of distress. Your dress is appropriate, and you seem aware, present, focused, and your speech is clear. All right, so I'm just going to start off by taking a look at your eyes. Do you have any visual aids, any glasses, any contacts?
Just for reading.
Okay. When's the last time you went to the eye doctor?
About a couple years ago.
Okay. Hopefully have you noticed any changes to your vision lately?
Not significantly, no.
Okay. Nothing you've noticed? All right, well, I'm going to go ahead first and just check your pupillary response to light. So if you want to take a look over my shoulder so I don't blind you. All right, I'm just checking that the pupils are constricting. And checking the other eye now. Wonderful. All right, if you want to take a look at my pen, out, in, great. And now I'm going to check the 6 cardinal fields. If you want to just take a look at my pen, follow that up. I'm just checking here for any lagging, any nystagmus or shaking of the eyeballs, any straining, and it seems like there's fluid movement of the eyeballs. Great. So now I'm just going to take a look at the eyes. Looking at the sclera, I'm just seeing if there's any jaundice, if there's any redness, any drainage, and I don't see any. Can you pull down on your eyes for me? All right. It looks pink and moist. Again, no pus, no drainage. Again, looking, I'm not seeing any lagging of the eyelids. Her eyes are symmetrical. The pupils are even, so that all looks great. Your eyelashes are evenly distributed as well. The eyebrows are symmetrical, so perfect. All right, secondly, I'm going to take a look at your ears now. Any changes to your hearing?
No, no changes.
Okay. Any ringing in the ears?
Nope.
Okay. Do you experience any ear infections?
No.
Okay. All right. Well, then I'll just go ahead and start by taking a look here. I'm just inspecting the ear for any redness, swelling, drainage, nodules, and I do not see any excess earwax buildup. I don't see that either. I'm just going to take a look. Is there any tenderness?
No.
Okay. So over here, again, just looking for any redness, swelling, nodules, masses, buildup of earwax, any drainage. I don't see any. Is this tender at all?
No.
All right. And they're symmetrical. Okay, great. All right, now I'm going to take a look at the mouth. Just taking a quick look, I'm not seeing any cracking, any bleeding. If you could open your mouth for me. I'm just taking a look at the teeth here. They're evenly spaced. I don't see any clear cavities. They're white. It looks like she keeps up with dental hygiene. And any bleeding of the gums?
No.
Great. So no signs of gum disease, no sensitivity when you brush, and you go to the dentist frequently?
I do, yes.
Great. Do you have regular teeth cleanings, hopefully twice a year?
Yeah. Every 6 months.
Okay. If you could stick out your tongue, and then take it to the left. I'm inspecting, and take it to the right. Perfect. So the tongue is midline. No pain or tenderness. I'm not seeing that her tongue is swollen. It's not too red. It looks glossy, pink, shiny, and her buccal mucosa is pink and shiny as well. Okay. All right, we're going to move on to her breathing. I'm first going to go ahead and take a look. I'm inspecting her respirations. It looks like her chest is evenly rising with each breath. I'm not seeing any lagging on one side. Even chest expansion. Are you experiencing any shortness of breath?
No.
Okay, you're not waking up in the night with any shortness of breath? Okay. Does it feel easier to breathe when you're upright rather than laying down?
No, I don't feel any difference.
Okay. Any cough?
No cough.
All right, great. Well then, after that, and I've inspected her respirations, I'm going to take a listen now. So each time the stethoscope touches your chest, if you could just take a nice deep breath in. Okay, that's great. I'm going to listen to the posterior lung sounds now. Again, just take a deep breath. Let me know if I'm going too fast. Okay, so the lungs sound clear. I'm not hearing any crackles, no wheezes. Do you smoke?
Don't.
Perfect. Good. Smoking is terrible for you. I'm going to go ahead and check your pulse ox now. This is just going to tell me a little bit more about how you're breathing and how your blood's carrying oxygen. Doesn't hurt. You're just going to sit right on your finger. Okay, pulse ox of 98, so that's great. Your blood is using almost all those blood cells to carry oxygen, so that's awesome. Are you feeling any sort of fatigue? Any more tired than usual?
No, my energy level's been good.
Okay, great. Alrighty. So I'm going to move on to your heart now. Have you been experiencing any sort of chest pain?
Nope, no testing.
Okay. No tightness, no crushing pain feeling, nothing, no pain when you inhale or exhale.
No.
All right. So now I'm just inspecting the chest again. I'm going to see if I can see any visible heaves or thrills. So just taking a look. I don't see any visible heaves or thrills. I'm going to palpate the point of maximum impulse. So my clavicular line will be like right about here. I'm not feeling any sort of heaves or thrills. Alright, so I'm going to go ahead and listen to your heart now. You can breathe normally for this one. I'm going to listen to the apex now, and I'm going to listen for a full minute. Okay, great. So I don't hear any abnormal heart sounds. I don't hear any S3, S4, gallops. I'm going to listen with the bell of my stethoscope now. I just want to make sure that I don't hear any bruits, any murmurs, that turbulent blood flow. I'm just going to go back through. Okay. No murmurs. All right. Now I'm going to check her jugular venous distension. I want to make sure that that's absent. I want to know that JVD is a sign of fluid volume overload. So if you can lean back for me this way. And I'm going to shine my light at a 45-degree angle. And I'm checking for any pulsations or distension about 3 centimeters above the clavicle area. And I don't see any. So no distension there, so no buildup of fluid. I'm now going to check for the presence of, lean back. I'm going to check for capillary refill time. to check for adequate perfusion. And these are all less than 3 seconds. I see pretty much immediate return of blood flow to the fingers. I'm also checking for any sort of clubbing of the nails. I want to make sure that they're not spoon-shaped and they look regular and well-groomed. I'm also looking for any cyanosis here. Perfect. Okay. I'm going to check the radial pulses. These are even with a regular rate and rhythm here, about a +2. And I'm going to check the dorsalis pedis pulses. Also both present, also about +2. And while I'm down here, I'm going to look for edema. I want to make sure she doesn't have any fluid buildup. Any tenderness? Okay, so no edema present. Okay, got your pulses. All right, so now I'm going to check your abdomen. Anything different with your eating habits lately? Have you been noticing anything isn't agreeing with you?
No.
Okay.
Any problems?
No food allergies?
No, none that I know of.
Okay, and have you been going to the bathroom regularly? Okay, when was your last bowel movement?
This morning?
And it was normal?
Normal.
It was well formed, uniform in color. Okay, great. So first I'm going to inspect before I do anything. I want to just check, you can lift this up just a little bit. I just want to check that there's nothing distended. Noting the overall appearance. No nodules, no masses. I'm not seeing any lumps on one side. Everything's uniform in color. All right. Now that I've inspected, I will auscultate first before palpating. So I'm just checking here for active bowel sounds in all 4 quadrants. Okay, her bowel sounds are active. They're not hypo or hyper. They definitely sound normal. Now I'm going to palpate. I'm going to do a light palpation first. Let me know if you feel any tenderness. I'm just checking here again for nodules, masses, swelling. All right, deeper palpation now. Is that tender at all?
No, no tenderness.
Okay. I don't feel any enlargement. No splenomegaly. I don't feel any enlargement of the liver. Okay, perfect. That is good for the abdomen. And now I'm going to move on to the skin. I'm just taking a look at her skin overall. Her skin is uniform in color. I don't see any obvious or apparent jaundice. No cyanosis. I'm going to check again. No cyanosis, no pallor. I'm not seeing any clear skin breakdown. No scars, no lesions. Do you have any moles or nodules on your body that you know of?
Not that I know of.
Anything that has changed color recently? Anything that might be asymmetrical? Skin looks clear. Do you wear sunscreen regularly?
When I'm going to be outside, I do.
Okay, perfect. Make sure you wear sunscreen every time you go out into the sun, especially with summer coming. It can be very damaging to your skin. Make sure you're wearing face sunscreen as well. Sometimes people forget their face. So the skin looks good, uniform in color. If you do notice that you have any new bumps or nodules, just note the size, and if they change in color, size, or appearance, make sure you come get that checked out. I'm going to take a look at her hair. Her hair is evenly distributed. I don't see any bald spots. It's not too fine or coarse. It looks like it's pretty full. Again, evenly distributed, long. It looks like she keeps up with grooming. It's not too dry or oily. We'll do her skin turgor. This is just checking to make sure she's well hydrated and her skin is nice and elastic. It pretty much moves back immediately. Perfect. Okay. Alrighty. So now we're gonna go ahead and do some neurological checks. Make sure that this gets us. Alright, we go over here. Okay, so first I'm just going to observe Allie's gait. You just walk towards me, Allie. Okay, I'm just noting you walk a little bit more. Noting the rhythm of her steps, they seem pretty even. She's not swaying, no ataxia. She's not leaning to one side. It looks like it's pretty fluid and effortless. Next, we're going to check her balance. If you could go ahead and close your eyes while you stand. I'm looking again for any swaying, looking like she's not in control. Do you feel any dizziness when you close your eyes? Okay, you can open on up. Now we're going to just check your range of motion. If you want to just mirror me, I feel like that might be easiest. So arms out to the side, bend up, back down. You can put your arms to the side and let's lift those shoulders up and do some circular motions. Okay, any pain or tenderness there? Mm-hmm. All right, we'll do some hip motions. Cross, back out, down, up, cross, back out, down. Let's check the knees here. Okay, so here I'm kind of also looking at position sense. She seems like she has good balance, good position sense. Again, not swaying. It doesn't look like it's difficult. Do you feel any sort of popping or clicking? Does anything hurt when you're doing this?
No.
Okay. So it looks like she has full range of motion without limitations. Everything looks pretty good. Okay, Allie, you look great. You sound great. I don't notice anything too alarming. Do you have any questions for me before you go?
I don't think so. When do you recommend me coming back?
I would say annually is always a good time to get your checkups, especially as you're getting a little bit older. Make sure you're getting that blood pressure checked at least yearly. And if you notice anything alarming, come back more frequently, but we'd like to see you every year. So let me know if you have any questions. Thank you.